What are corns and calluses and why do they cause pain? Hi guys, it's Kent here and I'm one of the podiatrists at Active Care Podiatry. And one of the common things that we do in the podiatry clinic is we treat corns and calluses. And basically they're two parts of the same condition. So corns and calluses usually go hand in hand, but you don't always have corns where you've got callus. Usually you've got callus where you've got corns. So callus and corns are just thickenings or hardenings of the skin, and they usually happen over the bony prominences in the feet. So if we have a look at a skeleton of the foot, and this is the big toe right here, often they happen under the foot here, on the tips of the toes, on the tops of the toes where they contact the shoe, or on the tips of the toes where we grip the ground. And so what happens is we get a situation where there's pressure placed on the skin which causes hardened skin, which is the callus. So the callus is the hardened skin. Now, unfortunately, that hardened skin causes more pressure, which causes more hard skin, which causes more pressure. And eventually this keeps looping around and around and around until we get a really dense, hard central section of hard skin. And we call that a corn. Now, usually a corn is either a cone-shaped or a dome-shaped on the bottom. And what we do, to remove the corns and calluses, we basically use a scalpel and debride the callus off the top of the skin, and then we dig the corn out. Usually this is painless, doesn't require anesthetic, and there's usually no blood. There might be a tiny little bit of blood, like a pinprick, if we get right down towards the bottom of the corn, but usually not. Generally, if we can relieve the pressure on the corn and callus, they will go away, but this is very, very difficult to do. Often it's somewhere where the fatty pad's worn out under the bottom of your foot, and the pressure reduction is very, very difficult to permanently relieve that pressure. So generally what we say is regular treatment and some moisturizer on those, and we use a 10 to 15% urea moisturizer. There's loads of those at your local pharmacy. They'll have their own brand that you can get. And this will usually help to soften the skin, and regular treatment and looking at your footwear so it doesn't cause any pressure over these areas will help. We can also make orthotic inner soles to relieve the pressure, but again, unless you're wearing these all of the time, generally they don't work 100% of the time. So that's what a corn and a callus is, and that's how we treat them in the podiatry clinic. And if you have corns and calluses, and if you're anywhere near one of our clinics, either at Capalaba or Victoria Point, we'd be more than happy to help you out.